Hi, my name is Dr. Esther Hess, and I'm a developmental psychologist certified in DIR floor time and specializing in the assessment, diagnosis, and treatment of children and adolescents impacted by developmental delays and/or regulatory disorders. Dr. Stanley Greenspan and his colleague Dr. Serena Weider have spent years challenging the traditional view of how children learn and develop. They understood the critical connection between emotional and social interaction and how these elements impact on sensory and cognitive functioning. Drs. Greenspan used this information to enlarge the way that clinicians think about and assess and treat children by having professionals consider the possibility that the functional disorganization, often associated with developmental delays like autism, could be caused by the interconnection of impaired neurobiology, developmental delay, and the relationship breakdown between parent and child. Many years ago, when I started the process of becoming certified in DIR floor time, I was part of a group of clinicians from a variety of backgrounds and disciplines who had come together to learn about treating the whole child. In our group, there were mental health practitioners, physicians, speech pathologists, occupational therapists, and educational specialists, all brainstorming together under one roof. I remember the last session of the last day of clinic. A speech pathologist got up to present her case, and quite spontaneously she asked me to join her on the podium to bring notice to the attachment concerns in the case that were so obviously glaring to me, but not necessarily noticed by the other clinicians. Similarly, the occupational therapist pointed out the child's sensory-seeking gestures, and the physician in the group made us pay attention to the possibility of an underlying seizure disorder that was potentially responsible for the developmental delays that we were all witnessing in that very case. In psychological terms, I had my aha moment. I understood there and then the multidisciplinary message that our mentors had been emphasizing all along. To help a child with developmental and/or regulatory disorders, you have to approach treatment from a position that takes into consideration and focuses all your efforts on all of the different systems that make up that child's most worrisome behaviors. Children impacted by developmental challenges often need a variety of services when it comes to dealing with their overall problems. Over the course of my clinical career, I have literally met hundreds of families where parents have expressed the need for one unified service center that approaches the healing of their child from a variety of disciplines, all working together as a team. From this need, Center for the Developing Mind was born. As founder and executive director, it is my pleasure to introduce you to Center for the Developing Mind, a state-of-the-art treatment facility that addresses the specific needs that children have when they are struggling with challenges. Clinical interventions include mental health, social skills, genetic counseling, speech and language therapy, occupational and physical therapy, educational support and individual educational planning, parent, sibling, and grandparent support groups and community outreach. Therapists are available not only on an individual basis, but also collectively to conduct multidisciplinary assessment and diagnosis. Center for the Developing Mind additionally offers combined therapeutic treatments within individual sessions and the opportunity for parents to be part of complementary case conferences to assure that everyone is working together as a team to heal both the whole child and support the family. I invite you to contact me at Dr. Hess at centerforthedevelopingmind.com or call me at 310-652-7581 for any questions or concerns that you may have regarding our center. We are conveniently located where the 405 and 10 freeways meet at 2990 South Sepulveda Boulevard, Suite 308 in Los Angeles, California, 90064.